there's a lot of things that we have to learn from this year, but a very challenging one, and one that a year when it's a very strange year when outlaws were the persons who weren't wearing masks. But one thing that's going to change us forever is that this year was the year that 988 was designated by the FCC, and Congress also passed the historic National Suicide Hotline Designation Act. So we'll focus our discussion on that today, as the Designation Act is going to require SAMHSA to provide reports that are relevant to 988 and its infrastructure and operations. And that has to be in by April 2021. So Richard needs your input and ours and quite a number of other stakeholders as soon as he can get it. And that's, again, one of the main reasons we're here today. But before we talk about that, I really want to take a moment to appreciate all of you and what we've done together this year. I mean, who would have thought that about 70% of our centers would be forced to work partially or completely from our homes this year? And y'all made that switch within weeks in many cases. And many of you all, many of us, aren't going to be fully back into our offices ever. We'll be working to some degree in many respects from homes. But the fact that we did all this without any notable disruption of services is pretty remarkable. Last year, we answered in last fiscal year, the SAMHSA fiscal year, we answered about almost 2.2 million calls. And many of you are also answering over the last several months quite a variety of other lines that were stricken with pandemic-related calls at higher levels than you'd seen before. So all of these balls being juggled simultaneously. But with a lifeline, many of you answered more calls locally than ever before, which really shows what happens when people invest in your services, when you get more funding to respond to calls. Through the SAMHSA grant in the last year, we were able to increase our investment in centers from under $3 million a year to over $14 million, which provided more help for our backup centers, more chat centers and more chat capacity. Also, we helped a number, about 37 local centers through capacity grants, as well as establishing 5 new tech centers, which I'll talk about in just a moment. But those capacity building grants, 13 different states, you remember that we put that out for states that were struggling to answer calls in the state. So a lot of those calls were going over to the backup networks. Well, we put in about $5 million to the grant to help centers in those states answer local calls. And as I mentioned, that was about 37 centers that received extra funds for their staff to answer more calls. And that led to about a 20% increase in more calls being answered locally in those states. So, and that's on average. Some had a lot more, some had a little bit less, and some are very much in progress. But in general, that's saved just in the last year 50,000 calls from going to our backup centers. So this time in 2019, nearly about a third of our calls were going to backup centers. Now less than a fifth of our calls are going to backup centers. And the number of chats that we're answering now is about 37% higher than it was the same time last year. And in the next year, we think we're on pace to answer about 275,000 to 300,000 chats, which is nearly 100,000 more than we were able to respond to last year. And I mentioned our text service, which is nascent, it's piloting. We've got 5 centers that have been funded to answer really just text from people who are randomly, serendipitously typing in 800-273-8255 into their phones, hoping that they can text that in. And that's somewhere between 5,000 to 10,000 potential conversations a month. And so our chat centers are managing those. It's not being advertised, but it's the beginning of something perhaps for us to be building on. We also, in this last year, some of you may remember that Vibrant launched our Safe Space program, which the idea was to provide people with more coping tools, perhaps while they're even waiting for chat. And we integrated the Safe Space coping tools into chat. So while people were waiting, they could find ways to calm themselves. And when they got off the chat or even off a call, they could use vibrant safe space coping tools to reduce their distress, perhaps even their suicidality. And since we launched that last March, now about 35,000 people are engaging with Safe Space a month, typically while they're waiting for chat. We've heard a lot of positive responses. An overwhelming majority of the people who've been using Safe Space say it's fantastic. A lot of them, I'll read you a couple of things. They said it really calmed me down and distracted me and made me forget about my thoughts and the crisis I was going through. I was about to harm myself. This saves lives. That's what it said. It helped me. It calmed me down. I'm not scared or shaking as much. Thank you. So while we're keeping our ship sailing right now and making it stronger, better, more innovative, helping people who are calling, chatting, and now texting with us, we've got to be planning to build a new ship, a bigger ship, one that carries a lot more people and hopefully to safe harbor. And so, as you know, in this last year, after FCC has said all the phone companies have until July of 2022 to start implementing the 988 switch on all their platforms, some are already doing it. T-Mobile, as some of you, probably all of you know, announced that they've already made the switch. They sent out a press release. Hopefully there won't be other major phone companies sending out a press release. But we do know that they will continue to implement throughout 2021 and certainly by July of 2022. So we need to be continuously ready. And I know Richard is very focused on that, and so is SAMHSA. There's also the FCC public posting of comments, and this is due to the Designation Act passage, where FCC is supposed to write a report on the needs or feasibility of geolocation for this service. And I think many of us believe geolocation is crucial for us to properly route callers within our state to the right centers. We encourage all of you to electronically file your comments. You'll see here where you can do that on this slide and the docket number that you put in, and give them your very personal, professional feedback on what it means to your center to have geolocation capabilities and what happens if you don't have those capabilities. And as you probably know, we are also taking a lot of inputs for 988 planning nationally. We want to get as much input as we can from as many stakeholders as possible. All three of our advisory committees have been weighing in heavily on 988 this year. Our steering committee is going to be meeting again next week. It's our third one this year. We've had 6 other meetings of national committees this year, really focused on 988 related issues. We're now convening 988 Crisis Services Work Group with a number of crisis services providers on the crisis services continuum side of things, specifically more kind of mobile crisis and crisis stabilization, and some of those providers, as well as 911, emergency departments, law enforcement, EMS, and coming together to kind of align recommendations that might help Richard and others envision what this system might look like. We're also providing some call volume projections, which I think many of you have seen. We sent those around, which suggests that in the first year alone of 988, we believe in the most conservative projection is probably around 6 million calls, 3 times more than what we're getting now. Depending on marketing and a lot of other factors, it could be as high as 13 million, according to some of those projections. So again, we need to prepare. And so that's what this planning process is all about. And we're also providing cost estimates, what it's going to cost for you, the centers, as well as for the operations and oversight of the network. And all of those we'll be providing to SAMHSA by the end of this year. So as we are looking at to help SAMHSA and the national level to plan for 988, where the rubber really meets the road for you all, and really for many of the consumers, is the centers, and how you all are going to be compensated, designated, and receive contacts appropriately and have the right staffing capacity to take care of them. And that's what the states are going to be determining. So I want to tell you a little bit about our 988 state planning grants. But actually, I'm not the person who's best qualified to do it. Matt Taylor and the network development team have been working steadily for the last several months to put together this momentous planning grant. 911, when they were established several decades ago, there were planning grants for all the states to figure out how to implement that infrastructure. There's not some equivalent here coming from the federal government. So Vibrant is providing this with private investment to make sure that our states have the support and the dedicated time to make the plans necessary to build this ship. So Matt, why don't you tell us exactly how those 988 state planning grants are working?
Thanks, Tom. And hello, everybody on the webinar. I'm so glad that there's so many people tuning in to provide feedback to Richard and SAMHSA and to hear about these updates. Let's go ahead and advance to the next slide here. So as John mentioned, we have just announced a major funding opportunity. We actually announced it on Monday. Information about this went to all of the Lifeline member centers direct from us. Information also went to the state suicide prevention coordinators via the SPRC, Suicide Prevention Resource Center. And information about these grants went directly to the state mental health directors or state mental health commissioners through our very important partnership with Brian Hepburn and his team at the National Association of State Mental Health Program Directors. You know, John's mentioned a lot of the great progress that's been made in capacity building, in part through the capacity building grants, but also through a lot of other initiatives that have in many ways sort of germinated directly from the states themselves. We've seen some big answer rate gains in states that have not had capacity building grants from us. And we've also seen some significant investments occurring in low answer rate states such as Minnesota, Michigan, Wisconsin, and Illinois. In some of these cases, the state mental health agencies have released multi-year, multi-million-dollar grants to either bring more centers into the Lifeline network or more specifically to boost up the capacity of the existing centers. There's a lot of good progress underway. But when we think forward about some of those call volume predictions that John just mentioned, and in fact, in the chat box, Francis Gonzalez has included a web link directly to that report. You know, in 5 years, we may be looking, 5 years post 988 implementation, we may be looking at somewhere between 13 million and 41 million calls coming in annually to 988. So that presents a lot of call volume and capacity challenges, and we want state agencies to take a real leadership role in partnership with us to be prepared for those call volume gains. So this brings us to the state planning grants. It's one of the largest award programs Vibrant and Lifeline has ever given. We're going to be issuing up to 9 million awards. As John mentioned, it's coming entirely from our own funds, private donations. These are not SAMHSA funds. A great commitment from Vibrant to the Lifeline network and the nation in this regard. All states are eligible to apply for this grant, and US territories are also eligible when they have an application in the pipeline with us right now. Now, in some cases, a few US territories are on the cusp of submitting their applications to join the Lifeline network. We encourage those territories such as Puerto Rico, American Samoa, and others in the Pacific to reach out directly to me as far as eligibility to join these grants. The applicants for these grants are the state mental health or public health or behavioral health agencies themselves. They must, however, partner with all Lifeline members in the state, at least in the early stages of this 8-month grant. We want these grants to ensure that every Lifeline member center has a seat at the table as the states are starting to put together their plans and as they consider how best to handle the call volume that may be coming through. That's an important distinction, and it's an important moment for the Lifeline network, because obviously what you're hearing inherent in my comments is that through the planning grants, we're actually asking states to take a little bit more ownership with us and making decisions about where the 988 calls will go. And that's because when we think forward to what 13 million, 41 million annual calls may look like, we have to see a very, very dramatic increase in the level of state funding that goes towards the network. And as states pony up more money towards this, whether it's through 988 fees, allocations of mental health block grant funds, Medicaid reimbursement, whatever it is, states obviously will want to take a more vested role in how calls are routed. So we want every Lifeline member center to have a seat at the table, at least initially through these grants, as states may make some of those decisions. Up to 54 awards may be made. We're estimating the awards will range between $125,000 to $340,000. I know that doesn't seem like much, but these are mainly grants designated to basically collect data from the states, get to build relationships between the state agencies and the Lifeline member centers if those don't exist, receive technical assistance from us, and ultimately submit an implementation plan. It's only an 8-month grant. The project period is from February 1st to September 30th. The announcement, as I said, was made on Monday. Applications are due on January 8th. We expect to make announcements on January 20th. But these are streamlined applications, only 5 pages long, and we want to see as many awards made as possible. The link to the grant website and frequently asked questions, which we're updating frequently, is there at the bottom of that slide. Next slide, please. So here are the major grant activities. As I said, every center has to have a seat at the table initially by sharing information with the state agency about their staffing capacity, about their connections to the crisis care continuum, about their answer rates, their call volume, their ability to do follow-up calls, or their interest in that. And then over the course of particularly the first 5 to 6 months of the grant, there's going to be extensive technical assistance provided by us to the state agencies and their partners around 8 core planning assumptions related to 988. I'll get to that in just a minute. Basically, the main deliverable is that by September 30th of 2021, the state agencies must have submitted a draft implementation plan to us about how they see 988 looking in their state. And a final version of that plan is due to us and SAMHSA on December 31st. As I mentioned, the range of crisis care continuum services, meaning call centers integration with mobile crisis outreach teams, their ability to access bed registries, their ability to see the availability of spaces in a crisis stabilization unit, that is part of the planning of this, because that is obviously part of the long-term vision of 988, is that our high-functioning call centers in the Lifeline network are fully integrated into that care continuum. I will say that while we do want state agencies to be the lead applicants on this grant and the main drivers of the activities, some agencies may choose to subcontract portions of their work. For example, part of the main work scope is that the state agency convenes multi-stakeholder implementation coalitions, at least on a monthly basis from April through September. Maybe a subcontractor would be chosen by the state to facilitate those meetings or even helping in the drafting of the plan. But ultimately, the state agency is the key driver in this, because we want them to fully understand all of the assets that you bring to the Lifeline network and all the challenges you may have in addressing the call volume that may be coming. Next slide, please. So here are the 8 core 988 planning considerations of the grant. We see for 988 to really function well, we need statewide coverage 24/7 for all calls, chats, text, and in many cases, some follow-up services. States and territories must provide realistic strategies for creating diversified funding streams for the 988 centers, for you, the Lifeline member call centers. And we're particularly focusing on this grant about the potential that exists if states will exercise their option to assess 988 related fees, much like 911 is funded throughout the United States. In fact, almost all states in the nation have a 911 related fees, and tens of millions of dollars are generated each year towards that. And so we really want state mental health and public health agencies to be aware of the amount of revenue that's generated that way and how it could go in incredible ways in supporting all of you as call centers. Call volume planning assumptions must be built into the 988 implementation planning. Again, we refer you to the document that Francis Gonzalez has listed there. We're also going to be looking about the potential to provide call volume estimates at a state level. We're not exactly there yet, but we may get there soon. As I mentioned before, the 988 implementation coalitions are vital, but also vital is that the states understand our clinical, operational, and performance standards to be a member of the Lifeline network, and that the states work in partnership with us to make sure that those standards are met and maintained and sustained. We also want all 988 centers to have a very robust access to local referral listings, as well as linkages to core crisis services, such as receiving transfers directly from 911, understanding a good working relationship with all PSAPs in the state, the ability to know the availability and the reliability of mobile crisis outreach teams, and basically other alternatives to law enforcement and EMS response. It's one of the main goals of 988 is to divert calls away from 911 and relieve the burden on 911 dispatch centers, which are often more costly and not the kind of services we know people need. Follow-up services is a big part. We know that obviously one of the most cost-effective and most impactful ways of reducing suicidality is to have robust follow-up services, whether that's after a call that presented imminent risk, or after discharge from an emergency department, or after release from an inpatient psychiatric unit or a crisis stabilization unit. So embedding the ability to do follow-up calls is going to be a central part of this grant and the technical assistance we provide. And finally, the eighth core assumption is that we all need consistency in the public messaging about what 988 is and isn't, and in particular, how it is different from 911. So our communications team is going to be providing a lot of technical assistance to all the awardees on this, and we want to make sure that whatever states are saying about what to expect when you call 988 is consistent with what we're saying at the national level and consistent with the resources truly available at the call centers that are answering these calls. Next slide, please. Finally, in addition to creating implementation plans in the draft and final form, we are continuing to want to engage states in realistic, sustainable strategies to boost the in-state answer rates. John's mentioned that we've seen many impressive gains right now in the last year. The backup centers themselves, I saw it in the chat, are noting that and appreciating it. But here's what our in-state answer rate looks like right now as of the last quarter. So July through September, you can see that we have a number of states in the 90% answer rate range, green there. We have many states in the 80% range, and we have a number of states at either at the far end of the 80% range who are almost ready to be in the 90% category, or many states that are just below 80% and are about to get in. I mentioned we have major funding initiatives underway in some of those red states, Minnesota, Wisconsin, Illinois. We expect those states that are going to turn yellow and potentially green within the next few quarters. So we are pushing that through these grants, the states partner with the centers to see what they can do to get to an 80% answer rate by the end of next year and 90% answer rate by the time 988 is fully implemented. So thanks for your time on that. We'll have more opportunities to ask questions. I know Richard's going to be taking a lot of comments, but I'll turn it back over to you, John.
John, you're on mute.
Sorry about that. This is actually a time it would be great for us to take a little question and provide a little answer if we can from you all. regarding the 988 planning grants. So you can put your questions in the chat if you'd like, and you know, we'd actually like to hear your voice if you'd like to, if you can raise your hand in some way. But if we read you in the chat, we may ask you to speak. It'd be good to hear from you. Most of the questions are wondering, at least the ones I'm seeing so far, is this being recorded and will it be available later? And yes, it will be available in our Network Resource Center shortly after the call. Francis, I don't know if you know exactly when we'll be posting it in the Network Resource Center. Do you know when?
Well, the latest it will be tomorrow.
Okay, great. Thank you. Any other questions about this exciting 988 state planning grant? It says if your state has multiple call centers, and this is from Mandy, do we need to submit the grant together? Is that correct? And the states will actually be applying, and all of the centers will necessarily be involved. That is all of the Lifeline centers, as Matt mentioned. Your involvement is mandated as part of their application. And so each one of you would be receiving, I believe, around $5,000 of stipend to be engaged. And so they would provide you with that money so you could devote some time and effort to help them in thinking through their planning. It's important. A lot of our states certainly know our crisis centers. Some they know better than others, and some they don't know really well at all. And most of them don't really know how crisis centers operate and aren't really familiar with the challenges that you all have. They don't understand call metrics. They don't understand staffing patterns or work or how to manage workflow. That's what you're there for, is to help them be educated on what you do, how you do it, what your needs are, what your challenges are, and how they can best be met under 988. So you won't need to be applying. They may ask you some questions as they're applying, so stand ready to do that. But you won't need to be actively engaged in the application process. Other questions? Francis,
John, while you're going through those questions, digesting those questions, I'll just emphasize a couple of points here. Because of the rapid turnaround on the grant, having it due January 8th and over the holidays, there is relatively little information the state agencies will have to get from you all as centers, at least on the front end. We're trying to make most of the key data points available to them publicly, but some state agencies may want to proactively reach out to you all as centers. But going back to, is there anything a center should do to make sure the state is applying? I would say absolutely. While we have pushed out this information to the state suicide prevention coordinators and the state commissioners and directors, I would say this is a moment for all of you in the Lifeline Network to be very, very proactive and speaking up to the centers about how hungry you are to be engaged in this process. And, while we're sort of by design making a seat at the table for you right at the beginning of the grant, this is an opportune time to really speak up to the state agency if you've not been doing this in the past, and speak about the value that you bring to crisis services in the state. We want to see as many of you engaged in the 8-month grant as possible.
Matt, this is Jennifer Battle. So I was interested, I know that y'all have been having conversations regularly, and we are very grateful with the state agencies about 988 and about Lifeline. I was thinking from a perspective from our affinity groups like National Association of Crisis Organization Directors and International Council of Helplines, that we would really love to send out sort of maybe a one-pager with some bullet points about some of the main talking points that Vibrant has had with our states, so that as we follow up and as we connect with states, especially those centers who may not have done anything like that before, that they have something to build off of, and they can say, based on conversations I know you've been having with Vibrant, here are some of the things that our center can offer you. Can y'all make something like that available, or is there something like that available? And I just need to know how to direct people to see it.
Yeah, it's a great point, Jennifer. I mean, on our website, under sort of the network section of our website, where it falls under the providers and professionals tab. We have state reports, and both semi-annual reports and state report fact sheets. And in addition to that, those are both annual and then quarterly reports. That's the kind of information that we are often focusing our briefings to state commissioners about. So I think one of the most important things all centers should do is visit that part of our webpage and understand what we're publicly saying about the answer rates in the state, who the centers are, and the efforts that we make to try and explain why an in-state answer rate may be low, even though there are very high performing call centers in the state. We try to make that point. Now, as far as what the states are supposed to understand about the call centers relative to this grant, the RFP actually indicates right in the beginning phases of the grant, there's going to be something called a landscape analysis. And the state agencies have to go to every single Lifeline member center and ask for this kind of data. And I would really encourage centers to look at the RFP, look at the section of the RFP that talks about the initial landscape analysis, and be ready to make your best sort of presentation or put your best foot forward in relative to those data points.
That is awesome. Can you send that out in an actual or ask Francis or somebody to put that in a hey centers, here's what we recommend you do.
You bet, Jennifer, thank you.
So a few other questions from the group here. Here's one from Sandri, Didi Hirsch. What will prevent counties from starting up their own hotline or expand existing lines to be a part of the 988 network? Here in California, there's some rumblings about that. So you have to be a member of the Lifeline network to receive 988 calls. That is something unique about the 988 number. So there are specific standards that you can just, there might be some hotlines that want to join, but they have to go through the joining process. If the state wants to designate a center that is not in there, they've got a road to hoe before they get in. And as noted, the very first thing that all states must do is first speak with all of you and find out what you do. And rather than going to the expense and extremes of starting a new line or expanding existing lines that are not Lifeline centers, their first conversation will be with all of you. So they'll still be making that decision, but they'll be making that decision with a lot more information than they've had before, not only from you, but from us in terms of how call centers operate and the standards and expectations of a Lifeline center.
Thank you,
Some
John.
other...
That was exactly the answer I was hoping to get from you. Thank you.
Good. Also, Geneva asked she asked that basically wanted that they do follow-up calls, and this is really true. Most of our follow-up calls at centers are not funded by funders. And so Geneva's wondering, well, will that be respected and understood in the call center funding process? And absolutely, we are going to be providing states with cost estimates per contact, and that will include also follow-up calls. So they'll need to factor that in. So while we're making that a standard for all the member centers, they're going to have to think, well, here's how much that costs, how many people are going to need to do that, and how much time is that going to take? And we'll give them all those algorithms that will assist them in doing so. There's other questions from Steve, who wanted to know about if there will be any advanced heads up if other carriers like T-Mobile come online. As soon as we know, we'll let you know. But I don't think there will be any more press releases. I think the reason T-Mobile put out a press release is they really wanted to be the first to do it. There's not a lot of press releases that really get a lot of play that says we're the second to do it or the third to do it. And I think the other ones are, from what I've heard, are looking askance at what T-Mobile did, because as they talk with us and other stakeholders, they understand that there's an infrastructure building process. And if it doesn't do them any good to make a big public hooray about it, then there's really no hurry for them to do that. And
John,
so from what we've been hearing from a number of providers, they're not going to be rushing to do it like T-Mobile did.
John, I do also want to flag that we can't necessarily say that a provider wouldn't issue a press release or turn on 988 preemptively, and we are just trying to create that open channel with those carriers in order for us to be able to alert all of you if we believe something like that is going to happen.
Yeah, that's right, Francis. And we are in contact with U.S. Telecom. SAMHSA is in contact with U.S. Telecom, which is they don't oversee all the telecom agencies. They're a trade organization, essentially, that the entities speak with and pay fees to, but they do listen to them, and they're helping us. And they understand what the capacity challenges are. But even with T-Mobile's announcement, we saw virtually no noticeable increase in calls. That didn't mean people didn't phone, but it's a reminder that unless and until there is a concerted, comprehensive saturation campaign that is sustained over a period of time, we're not likely to see a surge in calls. We might see a steady drip where the water level of calls starts to go up over time, but we're not likely to see a big surge. Certainly there'll be some more over the coming months, articles about 988, but in isolation, I don't see those having the same kind of impact on call volume as a concerted ongoing campaign. But cumulatively, they might be adding more and more drops of water to the bucket, and we'll see a little bit of call increase. I imagine higher next year than we saw this year. Let's see if there's other ones here. Can the planning grant help cover implementation of new systems to assist in the growth? The planning grant is entirely for planning. And part of that planning is figuring out what is it that you need, what do the states need, what do the centers need, and how are you going to fund it? So in those conversations, they might determine, well, now that we see what you need, and now that we know where we can find the funds for it, and we need to start building now, maybe we can give you the funds now. So there's nothing that would prevent the states from providing funding of their own at any point. In fact, they can levy those fees for 988 as we speak now. And my understanding is that NASHBID is going to be disseminating model state legislation for 988 that includes levying fees from wireless carriers. So that may lead to funding that can provide them with sustaining some of your capabilities now, as well as building on them. But this grant alone is really entirely devoted to the planning process.
I just want to jump in with a time check, John, as well. So we can maybe have one more question and then move to the second.
Yeah, that's a good point, Hannah. We want to give a lot of time to Richard for the next 45 minutes if we can. And why don't we do this? We're going to capture all the questions in the chat, and anything that I haven't answered, we're happy to respond to. There'll be some FAQs over time that we can certainly provide for all the network, because one question that somebody asks may be a question that many others have. So over time, we'll be putting together those FAQs. But this is an exciting period. You'll be hearing from your states, you'll be working with your states, and you'll be giving input as well as getting input from the states. And I think that's where the rubber's going to meet the road. Thank you all. And let's go to the next slide and introduce our colleague, our leader, and the maven of suicide prevention here in the country, Richard McKeon. Richard, if you could talk a little bit about what it is that SAMHSA needs for the Congress to hear in April.
Thank you, John. So it's a pleasure to be able to talk with all of you here today. SAMHSA is very much interested in your input. I do want to take a moment to thank John and the team at Vibrant for their initiative with the planning grants going out to states. This is not a SAMHSA funded initiative. Vibrant is funding this with private donated dollars. And one of the reasons and SAMHSA is not funding it is not because it's not that we don't think planning is important. On the contrary, we think planning for 988 is extremely important, and we're grateful that Vibrant is doing this. But rather, for SAMHSA's dollars, we feel that the priority has to be building community crisis center capacity as quickly as we can. You know, particularly as telecom providers make 988 operational in the run-up to July 2022, with T-Mobile having been the big group, you know, that's made many millions of, given many millions of Americans access to this. And we don't know, the order of the FCC encourages but does not require telecom providers to coordinate with us. T-Mobile did, so we're trying to track as best we can. The FCC is trying to track as best we can, and we'll try to share that information with you. But given we don't know exactly, you know, how many Americans will have access exactly between now and at different time points between now and July 2022, SAMHSA is really wanting to emphasize the importance of building as much capacity as quickly as we can. And right now, SAMHSA is kind of in a holding pattern. Those of you who are familiar with the appropriations process know that the entire federal government is in a continuing resolution that expires tomorrow. People are expecting there'll be another 1 week continuing resolution. It could be by the end of next week that we will know how much funding SAMHSA will have for the Lifeline for the current fiscal year that we are now in. And you know, our intent will be to, when we know how much money that we have and we see if there is any increase, that be focused as much as possible on building capacity. In part because of SAMHSA's concern about the importance of building that capacity, our Assistant Secretary had a call which was open to all 50 state mental health commissioners, which I think was very well attended, and you know, discussed these issues, you know, including the fact that you know, SAMHSA has not gotten a dramatic increase in funding for the Lifeline. We have gotten some increases since the 3-digit number started. It's gone from a $7 million grant to a $19 million grant, and we'll see what happens this year. You know, we also talked with them about the new state authority since the passage of the Hotline Designation Act in October for states to be able to fund local crisis centers, as well as services like mobile outreach and other acute mental health care services, using a fee on cell phones or voice over internet, you know, services. And mental health commissioners did express interest in state model legislation about that. So a number of stakeholder groups led by the National Association of State Mental Health Program Directors have been working on this. They've been sharing this with SAMHSA. So we're anticipating that very soon something will, you know, go out either from SAMHSA or from NASHBID or both, with some suggestions about what states can do. So let me put it this way, and this is the way I've been talking about it. The move to 988 is, in my opinion, a once in a lifetime and a once in a generation, at least, opportunity to improve mental health crisis services in the United States. That it is an opportunity to reduce the use of police. If 988 is used instead of 911, I've learned about some wonderful initiatives that are taking place in Jennifer Battle's group at the Harris Center, also in Austin, One is beginning in Los Angeles that involve co-locating of 988 and 911 centers and the ability to divert from 911. But of course, as 988 becomes more publicized, each individual in crisis will have themselves the opportunity to divert from 911 simply by calling 988. So there's tremendous promise, but obviously there is also a risk. SAMHSA estimated in its report to the FCC that a doubling of call volume, basically from 2 million to 4 million, would need an additional $50 million. And we have not received anything close to that. And of course, we don't know over time what that volume will be. There are all kinds of projections. SAMHSA is looking at them. Clearly, the ultimate resources needed will depend in part on what the call volume is, but also the scope. If it's focused on suicide prevention alone, or the language of the law talks about suicide prevention and mental health crises. So there are some crucial issues for planning, for dialogue. I'm heartened that as many people are now paying attention to 988 as they are, because we can't wait until July 2022. Let me just mention a couple of things, and I'm going to pivot to talking about the two SAMHSA reports. As I said that, so SAMHSA is very much interested, engaged, and figure out any way possible we can get help to local crisis centers. Some of you may know that SAMHSA has explicitly supported a new 5% set aside in the mental health block grant. Congress has yet to approve that, so we don't know if that will be happening for this fiscal year or not. As you may know, every state gets a SAMHSA mental health block grant. So that's one possibility. The Lifeline appropriation is another, and this new state authority is yet a third. SAMHSA has received one-time COVID funding. We were particularly pleased that 6 Lifeline centers were successfully competed for what are called SAMHSA COVID Emergency Suicide Prevention Grants. These are short-term grants aimed to help our concern about the potential for rising suicide risks because of COVID. So 6 Lifeline centers received these $750,000 grants. We were also able to use COVID funding to fund 3 additional Lifeline Crisis Center follow-up grants, which have been expanded to really focus on the vision of Lifeline Crisis Centers being the hub of a coordinated crisis system and as one of 3 essential services. So there are now 5 of those grants that go directly from SAMHSA to Lifeline Crisis Centers. And earlier this week, SAMHSA followed up its release of national guidelines for behavioral health crisis services with an additional publication that includes not only those guidelines, but 10 specialty papers that are supporting that effort, including one specifically on child and adolescent mental health crisis services and how that would look under 988. Also one on rural areas, on ethnic, racial, and sexual minorities, rural areas, and others. So it's an important document. Be aware also the way SAMHSA has explicitly endorsed the importance of Lifeline crisis centers as becoming hubs of crisis service delivery systems, within the state. I think that's important as well. So anyway, so let me pivot now to the 2 reports SAMHSA has responsibility for. And while these are not due to the Congress until April, the reality is that these kinds of reports take a long time to go through federal clearance processes. So they're due in mid-April, but we are writing them right now. And because these two reports so intimately involve you all, I wanted to make sure we heard from you today. And also we'll be providing a way that if you have additional feedback that you want to give in the next week or two, that you can provide that either to me directly or through Vibrant as the grantee. So here's what these reports say. So the first one, which is incredibly important, but also somewhat straightforward, is that not later than 180 days after the date of enactment of the act, the Assistant Secretary for Mental Health and Substance Abuse and the Secretary of Veterans Affairs shall jointly submit a report that details the resources necessary to make the use of 988, and then the language that they use is operational and effective across the country. And when they're using this language, they're not talking about what the telecom companies need to make it operational, which is already addressed in the FCC's report. Rather, this is what's needed for you all to be able to handle these calls and for the additional services that may be needed. So if you think about it, if let's say there's a doubling of calls to the Lifeline. Well, if there's a doubling of calls to the Lifeline, what might that mean in terms of the increased number of mobile crisis outreach visits or of need for outpatient services? Certainly the need for telephonic follow-up services. So those are all the kinds of things, and these are explicitly referenced in the Act. So this is something that I very much, and SAMHSA very much wants to hear from all of you because it affects you, so directly. And we hope that this will be very influential in guiding resources from the Congress in the years ahead. That would certainly be our hope. If you can move to the next slide. Okay, so here's the second report. Second report has to do with training and access for high-risk populations. Again, same timeline, 180 days. SAMHSA is asked to detail a strategy developed in consultation with the CDC and NIMH and organizations capable of providing nationwide suicide prevention and crisis services for LGBTQ youth, minorities, rural individuals, or other high-risk populations, and for SAMHSA to offer support or provide TA to training for NSPL crisis centers to increase competency in serving high-risk population, and for us to make recommendations regarding facilitating access to specially trained staff and partner organizations for high-risk populations, and strategies for optimally implementing an integrated IVR or other equally effective mechanism to all NSPL call centers who are from high-risk populations to access specialized services. So, as I said, a bit more complex than the first report, even though the first report has huge implications. This is really about both access to specialized services for high-risk populations, but also training for Lifeline centers in responding to high-risk populations. So this has more multiple components. So because both of these things very much impact every crisis center in the Lifeline network, we are very much wanting to know what your input is. And if you think of something after this call, please feel free to email us or Vibrant, who will get the information to me so we can take it into account for our report. And so what I want to do is open it up. I'm going to take a quick look in the chat. It says, can 988 funds to use to fund other components of the crisis continuum of care? For example, statewide mobile crisis or increasing crisis stabilization bed. If so, what can be done to ensure that Lifeline centers are getting the funding they need to build and sustain capacity? That's a great question. Let me respond to that. That would absolutely be the sole and the exclusive focus of funding through the Lifeline appropriation. You know, that is what that focus would be about. Would not be about expanding mobile outreach services, would not be about expanding crisis stabilization services. If there were to be a 5% set aside for the mental health block grant, it might cover all of those. Since it hasn't passed, we don't know what it would say as of yet. If it does pass, we would know more about that. But presumably that would have a broader focus. It's but what would definitely have a broader focus would be any state legislation on the use of 988 funds where they were to impose a fee or a tax. Because the language of the already passed into law Hotline Designation Act clearly states that. It clearly states crisis call centers, but it also cites mobile outreach, and it has language about other acute mental health services. It also has language about trying to monitor in a way that's simple to the way 911 fees are monitored to make sure it simply doesn't get used for other state priorities that may have nothing to do with mental health crisis services. So that's the answer to that. And it really depends on the on what the funding source ends up being. I do think this needs to be a strong federal state partnership, but to the extent to which Lifeline appropriations increase, SAMHSA's focus will be on increasing resources to the Lifeline crisis centers, not to other services, even though we think they are incredibly valuable and certainly would support other resources going to them.
Hey, Richard, I wanted to add something to that I thought was really important. States obviously going to make the decision as to what they fund, but this is one of the strengths of having a central administrator, is that they're going to be requiring metrics across the network. And to the extent that states are unable to meet those metrics, then they're going to have to be responsible for answering for that. They're going to have to provide a report to Congress that explains why they're funding in a certain way. And if they're funding in a certain way that is not meeting quality service needs that the administrator is providing, then they're going to have to explain that. And certainly the technical assistance that we're going to be providing over the next year is going to make that very clear to states that your front door needs to be strengthened before your back door really is going to be capable of managing all the needs. First and foremost, the suicide prevention is most likely going to occur through the call centers responding more so than mobile crisis teams, because they're going to be responding to a lot more suicidal callers. So a lot of the TA that we'll be providing will educate the states as to the need to provide resources for the crisis centers first and foremost.
So we would really like to open it up to your questions, but also to your comments. We really want to hear from you about what you feel is needed, because this affects you so significantly. So, I will be very much engaged in the drafting of both of these responses. And as I and my colleagues at SAMHSA are doing this drafting, we want to know not only what we think, but what you think. So please, again, questions are fine, but also, please share what you think.
So feel free to unmute yourself. If you do want to speak, you can also post in the chat. We'll be capturing that. And at the close of the meeting, we will share a couple ways for you to share written feedback. But for the next 20 minutes, we do just want to open it up to let anyone speak, as Richard said. So just unmute yourself if you do wish to speak.
Now, I am presuming that you think that you will need more resources. If that is incorrect, let me know. If it is correct, let me know too.
This is Sandri. If I have a question.
Sure, go ahead, Sandri.
Thanks, Richard. So one of the things, the issues that we've come across recently, and it came up during a crisis con discussion as well. Is there some sort of official high level communication with NINA, and so that trickles down to the individual 911 PSAPs, where the messaging is kind of like, here's what we think is going to happen when 988 comes into place and that sort of thing. Because what we are finding is that some of our 911 partners aren't even aware of 988. And it would be really great if there are some, we talked earlier about maybe some good talking points for these planning grants, but really this is also about overall messaging. And I don't know how involved Nina is with this. If 988 would become part of Lifeline, would we become part of Nina as well? Something to that extent would be really, really helpful so that we do have a common and correct message to share with our 911 partners.
Thank you, Sandri. I think this is a really important area. I've not been in direct contact with Nina myself. I know that Lifeline, has had some ongoing contacts with Nina, but I've been very much emphasizing the importance of upping the coordination with 911 systems on a federal, state, and local level. And we, I now have ongoing communication with the Office of Emergency Medical Services in the Department of Transportation, which is the part of the federal government most intimately involved with 911 and with EMS. Earlier this week, I presented to the Federal Interagency Task Force on emergency medical services regarding 988. And I've been, as you know, Sandra, because we're in the process of setting it up with you and Dee Dee Hirsch, and having conversations about really model projects that are going on locally that really are moving things forward in terms of 911, 988 collaboration, with several Lifeline centers now involved in co-location with a Lifeline responder co-located with 911 at the PSAP. But I think that one thing that I think to me is really clear is that 988 will automatically bring to mind in our communication efforts, in our the question of when do you call 988 versus 911 in a way that was never really made front and center for 1-800-273-TALK. It's always been relevant, it's always been important, but the very existence of a number that is so close to 911, I think underscores people are going to be asking this question. We need to be able to answer it. And we need to be able to describe the differences and to have collaborations on the federal level, on the state level, and on the local level. So I think it's a really important point.
Sandri, I wanted to just extend Richard's answer to your question, which is yes, we've been in contact with NINA, and 2 points. One, the president of NINA, Gary Bell, is absolutely committed to working with us to message to all the 911 centers about the coming of 988. And he says they would be thrilled by and large to be engaged at the local level in your planning efforts. And then the second part is that in the 988 state planning grants, there is a very strong push and encouragement, if not a requirement, for all the states to engage 911 PSAPs in their planning efforts.
And
I have a thought or a comment, if I may. This is Sharon from 211 Palm Beach Treasure Coast.
sure, go ahead.
Okay, so my comment relates to it's preliminary, but it relates to the concept of co-locating 988 and 911. And so the thought that came to mind for me immediately is that I'm in a location where I have a service area of 5 counties, and in just one of those counties, we have 26 law enforcement entities. So that's not 26 different dispatch centers, but it's certainly more than one. It's probably more than half a dozen. So in my entire service area, there are multiple law enforcement partners. And so I would just offer that up as something, as food for thought when you're talking about co-locating. We already have challenges that our headquarters is in one spot and not in, some of our service areas, of people feeling like that maybe we don't belong to them as much as we belong to the county that we're seated in. So I think that's something important to bear in mind.
Thank you very much for that. And let me just also mention that I do think it's also important. I would love to kind of restart conversations with 211 centers and 211 leadership. And we had some of those discussions prior to the FCC's order. But I think the interface between the important work that 211 does, and particularly centers like yours that are blended centers that are answering 211 calls. In North Dakota, for example, there's one Lifeline center. It's a 211 center. So I think those are also really important conversations for us to continue to have.
Well, we welcome that. And I think that when you first opened it up to questions, many of us were probably quiet because there's just so much information. I think we're going to need time to digest it, but we welcome an open dialogue as we move forward together.
Yeah, and let me just say, don't think of there as being while I need input quickly, there's no reason to stop if you have additional input in February, for example. One of the ways that things happen is that, we send a report forward, it goes through multiple levels. It often kicks back to us a couple of times. So if I learn something that's really key, but it's after we've already drafted and sent it forward, I might get another opportunity to put it in. So if you have important feedback, I don't want any Lifeline center to feel like that it's not important to communicate it to me or not important to communicate it to SAMHSA. We are completely aware that we rest entirely on your shoulders, for this. And I would say, because I saw another chat around this, that one of the things that we are planning on emphasizing in our report is the tremendous difference between the structure of the Lifeline and the structure of the Veterans Crisis Line. It's frequently confused and it has major implications. So right up front, we're going to be describing how different these are and how there are different needs.
Sure, this is Justin Chase. Real quick, I really wanted your take and thoughts on one piece I haven't seen really discussed in this is any coordination and collaboration with the Centers for Medicare and Medicaid Services and the opportunities and potential for a national strategy for opening up billing codes to allow for Medicaid reimbursement. I think a lot of states don't know that opportunity is there to work into their Medicaid plans. And for us, we talking with a lot of different states. I just see there's a lack of opportunity there, and states can really draw down federal match dollars to not have to appropriate directly out of their administration to cover some of these 988 costs. But how do centers and states work collaboratively to I can go after some of these Medicaid dollars that I think are there and appropriate for use.
That's a great point, Justin. Thank you for making that. And I know in Arizona that you all have been an innovator, and your state authority has been an innovator in drawing down Medicaid funds for your services, including your crisis hotline there. So I think I have tried to look into this. I've talked with a number of folks, including Kirsten Baronio, who is no longer, she's left CMS. She was the senior behavioral health advisor to try to increase my understanding of this. So, so we are certainly open to articulating what some of the needs are. So here's the issue. We can certainly say something like it'd be great to be able to draw down more Medicaid dollars. But my experience in terms of CMS is very similar to when I worked on the Hill. I had the pleasure to be a congressional fellow in the office of Senator Wellstone about 20 years ago. And whenever advocacy groups would come to the senator's office, it would always be with a very specific ask. In other words, it wasn't, hey, Senator, you need to do more about suicide prevention, or you need to do more about mental health crisis. It would always be, here is the exact ask of what could be passed or in an appropriation or in authorizing legislation. In CMS, we actually did have, in conjunction with the Action Alliance a number of years ago, several meetings with CMS. But what's really needed is to be able to specify exactly what the ask would be. So, for example, exactly what needs to be asked for, or which waiver can be utilized in which way. So the more specificity, the better. And the more specific input that you can provide to us, then we can certainly consider including that, at least in the initial drafts for this report to Congress, which would be more effective. We can say CMS needs to be engaged, but that's not likely to have as much of an impact of something more specific.
This is Eleanor Letcher from Contact of Mercer County in New Jersey. Small crisis center, and we've used volunteers to answer our suicide lifeline calls and chats and so forth. Now, we train a lot of college students. Our people are not paid, they're volunteers. Is there a role in the future for 988 for trained volunteers, or do you see all the staff being credentialed employees?
Well, the way that I look at it, SAMHSA owes a tremendous debt to all of the crisis centers who have answered these calls for so long with very limited compensation, for doing so. And we know, and John, I think, knows the numbers from the Lifeline's surveys, we know that many of our crisis centers rely on trained volunteers. So I would regard trained volunteers as continuing to have an important role, now moving into the future.
Good.
And I certainly would support that. And Maddie Gould's work on imminent risk, for example, didn't show a difference between salaried employees and trained volunteers. What it did was that it showed a difference between around how often you do the work. Mm-hmm. So a volunteer who only works a couple of hours a month could be more problematic than a regular volunteer. Mm-hmm. And that regular volunteer could have much more experience than many trained mental health professionals. Now, to the extent to which states invest funds, states get to call the shots for what they're going to fund. So SAMHSA would not intervene there. But from my point of view, trained volunteers all across the country have played a critical role, and we recognize that. you know, and I know, Eleanor, when I gave a plenary in New Jersey, you
Yeah.
introduced me to a couple of your volunteers.
Yes, yes.
You know, and they were a trained volunteer, but one of them was a mental health professional.
Oh, yes.
And the other was an FBI agent.
That's right.
You know, so, you know, we understand the quality of many of these volunteers, as well as some of the incredible training programs, you know, that exist. Jennifer Battle was just briefing me on some of the incredible, very specific competencies that they train their folks on. So anyway, that would be my response. But
Well, I'm
you know,
very pleased to hear that, because
whoever pays gets to call that.
yeah,
PCL does, you know, does have that as a requirement. You know, Georgia Crisis and Access Line, you know, does, and some others.
yeah. Well, thank you. Thank you. It was nice for me to hear that.
Okay.
Just going to jump in here with a 5-minute notice. So we might take one more comment or question. Then I will share a slide at the end, which gives you instructions on how to submit anything else that you may think of after this meeting. So we'll take one more.
This is Pat Morris. I guess I'm going through all of the chats, and just from a summary point of view, speaking for crisis centers, and I'm just one of several, it's not just resources that we're going to need, but I think there needs to be a strategic time frame to be able to ramp up. And I know we're having conversations, really robust conversations in the state of Washington around that, but I'm really hopeful to be able to have enough time to be able to position each call center in a way to have adequate staffing, you know, the phone stations, just to be able to have enough time for that anticipated expansion. So when we do get to a point of 988 being initiated, that we're ready to go and we're not playing catch up after it starts.
That's a great point. And I think that's certainly something we can take into consideration. And while there are some parts of this that are outside of our control, you know, so we can perhaps think through. Right now we have a, you know, pre-universal operation of 988 phase that we're in, and that will continue to July 2022. And then we'll be at an initial phase of full national implementation. And then that will likely build over time. So I can certainly talk with John and his crew and others, you know, around seeing what we can do. I think that's a great point. Thank you for that.
Great. Thank you, everyone. I'm going to reshare my screen again one more time. And I'll flick to the next slide. So
there we go.
Yeah. So we have 2 different ways for you to share feedback following this. You can email Dr. McKeon directly. His email address is up there on the screen. You can submit written feedback and comments by that link that is on the screen. I understand you cannot click on it, so we have posted it in the chat once. We'll post it in the chat again. I think Francis is doing that right now. We will also be sending out this recording with any resources, the links to the reports, things like that, a couple of white papers that Richard mentioned, along with the link to the feedback form. Probably tomorrow, so you will have access to watch this again, see everything that's on the slides, and you can linger on the slides at your leisure to take in the information and submit more to Richard as we go forth. One more note I wanted to make as well is if you do have further questions about the planning grants, to email Matthew Taylor. I think we'll pop the address in the chat, but it's mtaylor@vibrant.org. And as he noted, we will also take some of these questions that were asked in this session and pop them up as Q&As on the 988 planning grants page on the Lifeline website. So Richard or John, if you have any final comments, definitely jump in. Otherwise, I thank everyone for attending today. This is one of our most well-attended webinars. And
I would just say thank you to every one of you in every Lifeline center across the country. Thank you for what you do every day to prevent suicide in America.
Amen. Stay safe and happy holidays to you all. We look forward to working with you in 2021. But again, thank you for an amazing year, doing amazing things. See you soon.